a very big voice. Can you hear me at the back? Right. So what I thought I'd do, just to kind of get us all in the mood, is to invite you to get yourselves comfortable in the chair. I know that's a bit of a challenge. Sit up as straight as you can, probably. You have to get hands in your lap. Feet on the floor. Feet nice and connected with the floor. And then I'd like you to close your eyes if you feel comfortable doing that. I know that freaks some people out, but close your eyes if you can. And I'd like you to just be aware of any sensations in your body. So good ones, bad ones. You might be feeling a bit achy, a bit uncomfortable. I want you to just be aware of sitting in the chair, what the chair feels like as it supports you underneath. Literally, what your bum feels like on the chair. And just be aware of the chair, how it supports you in your back. How the chair's holding you. And just be aware of your feet being on the floor. Now I'd like you to just be aware of your breathing. And you might want to put your hand just at the top of your tummy. I don't want you to change anything. I don't want you to try and change your breathing or anything. Just be aware of how gently it rises and falls. I want you to be curious about yourself. Imagine that you're an alien that's come to Earth and you've never seen breathing before. So you're just watching it to see what happens. How quiet it is, how gentle. And I want you to try and stay focused on your breathing. Just be aware of how the air goes in through your nose and how warm it is when it comes out through your mouth. Now when you do this, your mind will start to wander. It will start to drift off. And it will start to think about things like what you've got to do today. You're going to have tea. Maybe you've got a problem that you're thinking about. I want you to just acknowledge that you've seen it, and then just refocus on your breathing again. So don't try and change it or chase the thoughts away. Just when you know that you've drifted away from concentrating on your breathing, just come back to your breathing. And when you wander, just come back again. And when you're ready, just expand your awareness back into the room and open your eyes and just gently come back. Everyone with us? Everyone here? Well, that's a little demonstration of one of the techniques that I use in the style of therapy that I do with patients at Russell's Hall. I'm a psychologist that works in rheumatology with Dr. Hale. And one of the things I do with people is to just kind of use a technique which is kind of in the cognitive behavioural tradition. It's called acceptance and commitment therapy. And part of that is a big element of learning how to be a bit more mindful about where we are in the present. So we spend a lot of time worrying about the past and about the future. And it's quite common to do that, particularly when you've got a long-term health condition, because the future can be a little bit of an uncertain place at the moment. You're not quite sure what's going to happen. And people have a lot of regrets about the past. There's lots of thinking about what they used to be like, things that they can't do now. We beat ourselves up quite a lot with our thoughts about how things used to be and how we feel we should still be somehow. So really what I do is try and get people to focus very much on the present if they can, to kind of think about what it's like to be now, and really try and draw a bit of a line under the past and not to worry too much about what the future might bring. To enjoy being now, essentially. And that technique that I did just then is one of those things that you can do. It's very relaxing, it helps with pain management, and it's certainly very good when your thoughts are racing and you're feeling a bit anxious or feeling a bit low. What we're trying to do really is to go from that to that. So that is Nathan. And he certainly knows how to relax. He doesn't seem to have too many anxieties about the past. I think his only worry is about if he's going to get fed. He can certainly relax in the present. So it's worth trying to kind of think about how present you are in your life. Okay, it's not unusual for people with long-term conditions to feel a bit under the weather sometimes. We know that it's common across pretty much most of the rheumatic diseases, and certainly people with other long-term health conditions experience low mood anxiety from time to time, so it's not odd. There are certainly things that you can do to help yourself. It was lovely to hear your outline of all the different things that Lupus UK can support people with. So there are local support groups. We're very lucky that we have the drop-in clinic. I think online support is great for some people, but others like to see people in person. So I think if you can manage to get to go and see people, that's definitely one of the things that you can do. Talk to people that feel like you do. Would you know when things are getting a little bit too difficult though? It's quite difficult to recognise depression because a lot of the symptoms mimic things like you might experience with lupus. I suppose the key giveaway is that if you're feeling pretty miserable and it's going on for weeks on end and it's happening most of the week, that's probably the key feature. And sometimes other people will tell you, but you don't seem to be yourself, something's not quite right. It's worth going and chatting to the GP so that they can really discriminate what's going on, what might be due to your mood and what might be due to your health. Things like feeling helpless and a bit hopeless and really worrying about the future and having a bit of a sense of doom and gloom are kind of key giveaways really. So I think it's worth just knowing when it's something that you perhaps need to get a little bit more assistance with. So one of the things I do with people, and it sounds pretty fairly silly and common sense, one of the fastest ways that you can boost mood is to do things that you enjoy. So in the cognitive behavioural tradition, we'd be looking at the behavioural. So we'd be looking at what can you do that actually might make you feel a bit better. So I had to think, okay, if I was going to do this, what kind of things might I do? I quite like going and getting my nails done. Particularly like getting my feet done, because reaching those these days is a bit more of a challenge. But it might be something very simple like that just makes you feel a bit better. One of the things that we notice with people that suffer with depression is that their ability to care for themselves tends to get a bit challenged. People that really are feeling very poorly will sometimes say to me, well, I can't even get out of bed, I can't get dressed, I've just got no motivation to look after myself anymore. So that might be a little bit of a telltale sign. So one of the things you can do is to make sure that you do get dressed every day. You do kind of make that effort to keep your appearance where you would normally expect it to be, as far as you can. Spend time with the people that make you feel happy. That's my little granddaughter there. She certainly makes me laugh my head off. She's 3 now, and she's just getting to that stage where she's chattering away and telling me all kinds of things that make me laugh. So it's good to spend time with people that you enjoy being with, not the people that make you feel worse when you come away after you've spent time with them. We've probably all got people like that. I know for those of you that have got children and grandchildren that they can be extremely tiring, and that's me as a relatively fit person. So I think also you have to learn to say no. There's no harm in saying, I can't do it today, but I might be able to do it next week. So it's kind of learning that you can say no to things as well. It's important not to give up stuff that you enjoy. So if you used to like going out for a meal, and you used to like getting together with friends, but you're noticing that you're perhaps not doing that so much now, think about whether, and it might need a bit more planning, it might need to get people involved, but whether there's a way of doing that still. So that's one of my locals. It's called the Swan. It's got a thatched swan on the roof. And I quite often drag people off there to have a bit of a family meal or get some friends down and have a meal there. I took my local book group there at Christmas and made them have their book group there. Sometimes it's things like eating chocolate. I quite like to eat chocolate, and it just makes me feel happy. Particularly in the middle of the week when I'm flagging a bit and I just need something that's going to make me feel good for at least half an hour. So there's no harm in moderation. Some of these things that just make you feel pretty good. Perhaps it's going somewhere that you love. A bit of a wander along the beach. My daughter took that photograph some years ago. That's, for those of you that are eagle-eyed, that's Barmouth up in North Wales. Lovely flat beach, have a bit of a wander there. Or maybe it's spending some time in the garden. That's not my summer house, I wish it was. But it might just be remembering to relax, maybe finding your nice spot and doing what we just did to start with. That technique is worth practicing every day. I would set an alarm on your phone and see if you can do it for a minute. And then when you can do it for a minute, try and do it for 2 minutes. And then try and do it for 3 minutes. And it's something that you can kind of pull in and do whenever you're feeling a bit stressed. So it's like riding a bike. You've got to practice it, otherwise you tend to fall off. So see if you can find 2 to 3 minutes in your day where you take yourself off and do something like that. Once you've kind of got the fun down and you're okay with doing that, see if you can add in things that give you a sense of achievement, because often that gets very challenged when you're feeling a bit miserable. And so you might want to add in things that boost your confidence or boost your sense of control. But fun and achievement are not necessarily the same thing. So That's my fun thing. My achievement thing might be actually doing the housework for a change. But that's a bit of a challenge. So it might be just one little task that you've put off and you've stopped doing that really you would like to get going again, that's going to give you a sense of what did it. So I would definitely start very small. So it might be just one little thing that you think you can add back in. I've got a few little handouts. I now realise I've got enough because I've only printed off about 20. But if anybody wants one and you want to leave your details with Yvonne, I will send it to Yvonne. I'm sure she can send it on to you. It's a little worksheet to go through that looks a little bit like that. And what it suggests you do is that you rate how you feel before and after that you do the activity that you've chosen. So you can actually see whether or not there's some progress. So on this one, I've picked walking the dog. I was feeling quite depressed before I went out. I was a bit miserable, didn't think I'd be able to do it. Really wasn't up for it. But went and did it, and then afterwards, yeah, actually I felt less depressed. It's only a gain of 3 on my scale, but it's still a gain. And so my depression went down a little bit. It also gave me a sense of achievement, because it might be something that I haven't done for a long time. And actually walking the dog's quite fun, so I gave that a fairly high rating. Not to start with, but at each point you can see that it actually went up. So while the depression went down, the sense of fun and the sense of achievement went up. Now you might all have things that you can think of that you could try doing that might alter how you feel. And it's adding in those little things that can make a massive difference to how your mood is. Now it kind of sounds like common sense, but often the best things are. And you may have people that try and drag you out and get you out a little bit when you're feeling down. They're kind of instinctively trying to do these things to see what they can add to make you feel a little bit better. So it's worth thinking about whether those are the kind of things you might want to try. So I thought I'd stop at that and ask you if you've got any questions to me. I can't kind of give you the whole range of the kind of therapeutic approach I take. That would be too difficult, we'd be here for a long time. But if you've got any questions, I'm more than happy to take them now, because I might have to go before the end. So my brain, yes, great. I might not hear you though, that's not...
Is there any one book that you would recommend for helping people with, mindfulness?
Well, there is a book, which is in my handbag actually. And my lovely other half has brought me today, bless him, he's not feeling very well. Can you grab that book out of my handbag? There's something called Activate Your Life. I've discovered this quite recently, and I'm very critical of self-help books. Generally, I think they just make me sigh. But this, I really do quite like. It gives you far more than mindfulness, but it does teach you that technique that we did at the beginning. It's got lots of other things in it to help you look at how you experience things, what your thoughts are like and what your feelings are like. And it's by Joe Oliver, John Hill and Eric Morris, and it's called Activate Your Life. I have to say... Yeah. Joe Oliver, John Hill and Eric Morris. And it's published by Robinson. I don't know, hang on. littlebrown.co.uk, so it's Little Brown Publishers. What this points out to people, which I think is really good, is that if I was to say to you, I'm a brilliant psychologist, I can get rid of all the things that trouble you. I can wipe out all your feelings and misery and can make you feel really, really good. Hands up how many people would do that. Don't want to feel better? Yeah? I've got the power. I can make you feel spectacular. Who wants to go for it? I've got the power. There's a catch though. There is small print. You'll have to give up all your feelings. So you'll have to give up happiness, joy, any of the other lovely stuff. Because unfortunately, when we sign up to being humans, we sign up to the whole range. We have to have the good, the bad, the ugly. I'm not quite sure what the other one is. But we have to feel it all. And generally when I see people, they've tried everything they can to stop feeling as bad as they do. And so my job is to say, actually you need to feel this. Feeling it's okay because it's part of the journey, it's part of who we are. It's kind of what you do with those feelings and how you move forward with them, because we can't get rid of them. The more you try and avoid them and the more you try and suppress them, the more they kind of get bigger and jump back and bite you a bit. So I don't have the power to get rid of everything I lied, but I've got some ideas about how you can move forward with them and how they can just be part of you and be okay. Mindfulness is part of that. It's about trying to live now rather than worrying too much about what did happen or what might happen. Any other questions? That was a brilliant one.
What more could be done to encourage people to see mental health help or even have counselling?
I'm really sorry, I can't hear you.
I'd like to know what more could be done to help people seek counselling or even maybe directed to counselling for mental health when they're diagnosed or when they have lupus.
So did you say you want to know how you get help for mental
Yes,
health?
I just actually
Yeah.
to help to get diagnosed for it in the first place.
Yeah.
I didn't even realise mental health problems were part of lupus until I actually had mental health problems,
Yeah.
for example.
Yeah. I mean, we are unusual in Dudley from a rheumatology perspective in that I'm actually part of the rheumatology team. So anyone that's attending the Dudley Group of Hospitals, anyone in their team can refer you to me. So that's one way in. I have a very short waiting list, so I'm booking new patients at the moment for the beginning of November. Now, in the community mental health teams, I know that that's perhaps a year or 2 year wait, if you're lucky. There are the options of private practice for people, but it is very challenging to get to see anybody in this country, as you know that. So we're unusual in that I'm the only one doing what I'm doing in Britain, in rheumatology. So I don't know if it's a good or bad thing, you're either cursed or blessed here in Dudley. There are other psychologists working within rheumatology units across the country. How easy it is to get to see them, because they tend to be on a sessional basis, I don't know. But there are organisations like Mind, and you can find their details on Google. They do come up. And they're very good, and they certainly have drop-in sessions in Dudley, and they certainly are quite active in the area, so it might be worth looking at people like that. I don't know if that answers your question, really. Yeah? Cool. Anything else? Okay. Thank you very much for having me.